Hi everyone, thank you for joining us today as we walk through your 2018 and 2019 open enrollment options through Painters USA. My name is Nellie Mulrooney and I am the account manager from Assurance Agency that works alongside Painters USA to bring you your benefit options. Just to go through a quick overview before we jump into some of the information we'll be covering, the medical will be moving to United Healthcare this year, and for your medical insurance, you will have a choice of two different plans, two different PPO options, and your dental insurance will be remaining the same. First, we're going to go over the medical coverage. So as I mentioned, you are going to have the choice between two different PPO options, and I am going to take a little bit of time to dive into those options and explain a bit more about what they are and some of the accessibility you have through those plans. So before we get started here, I just want to highlight for you a couple of important things on the slide. The first is that while this plan option does cover both in and out of network benefits, for the focus of today, we are going to only look at and discuss in-network benefits. Also, just so that you know, here on this left-hand side where it says office visits, specialist visits, those are not the only things that are on this plan. We typically like to really highlight the most utilized parts of the plan so that you can know some of those costs up front, but this is not an exclusive list. So the first plan option here that you have is the AHA6 PPO. So this PPO utilizes the Choice Plus network, which is United Healthcare's largest national PPO network. As I mentioned, it does have in and out of network benefits, but again, we're going to really focus today on these in-network benefits that are highly utilized in a plan. If you look here on the left-hand side, it illustrates for you office specialists and preventive care. So for an office visit, you're looking at a $20 copay. Your specialist visit is a $40 copay. And your deductible on this plan for individual coverage is $1,000 and for family is $2,000. Your out-of-pocket maximum on this plan for individuals $4,000 and for families $8,000. Once you have met your deductible amount, so that's this amount listed right here, then co-insurance, which is cost sharing between you as the healthcare consumer and the plan, kicks in. So this is illustrated here for you as 80% after deductible for in-network, and this 60% is for out-of-network. So after you've met that $1,000, $2,000 deductible, then the plan will pay 80%. And this is for specific covered services. And again, not everything is illustrated on this slide, but in your benefits guide and also in some additional resources, we do illustrate more in depth on what exactly is covered within the plan. For emergency room visit, that would be a $250 copay and then 80% covered. And if you look at the prescription drug benefit at the bottom, this is going to illustrate for you some really important details on the different drug tiers. So something that I do want to make sure everyone understands is that just because you or a dependent may be paying a really low level generic copay now on your Blue Cross plan, that does not mean that you will automatically pay the $10. It depends. So every medical carrier has a different formulary in which they can charge the amounts that they see fit for the particular prescription drug. If you have a question or you'd like to see that formulary and have an idea up front of what that cost may be, let Eric know, and we can definitely be in touch and walk through some of how you can determine those costs. But it is important just to note for retail and mail order, this formulary is different than Blue Cross since UHC has its own. These amounts here are the tiered off amounts that essentially those prescription drugs are filtered into. So the $10, $35, and $60 are broken up in 3 segments, and then for mail order, $25, 87.5, and then 150 are illustrated here for you. Your second plan option for your medical insurance is the ANCN PPO. So just like the PPO we looked at, this also shares that Choice Plus network. So both PPO plans have the large national network, which is UHC's largest network available to anyone that elects the plans. If you look on this particular plan, it is set up to be a little bit different than the plan that we reviewed on the prior slide. So I will walk through some of the differences here. Your office visits and your preventive care are covered at 100%. Your specialist visit is a $100 copay. Your deductible here, same, the individual is $1,000 and families $2,000, and your out-of-pocket maximum is going to look a little bit different here. So your out-of-pocket max, the most you're going to pay out-of-pocket on the plan, for this plan is $6,500, or for family, $13,000. If you're looking here at these co-insurance levels, again, as I mentioned on that prior slide, the percentage that you pay listed here after the deductible, this is what the plan is paying. So the plan is going to pay 80% once you've met this deductible amount here, and you are responsible for the remaining 20%. Then for out-of-network benefits, this would be the 50% after deductible. Again, just like that former page where we were looking at the other PPO option, there is in and out-of-network availability on this plan. However, for the focus of our presentation, we're really looking at in-network benefits and also the more highly utilized components of the plans. If you see at the bottom under the prescription drug benefit, this is going to look a little bit different than the slide prior. So the way that the formulary is set on this plan is different. So the prescription drug amounts, again, no guarantees of whatever you were paying before and how that's filtered in. It's very different. It depends on the formulary. So you'll have to check to ensure to know upfront what you'd be paying if you were a dependent, have any need for prescription drugs. If you look here under retail, you're looking at a $5, $50, $100, $250 for retail, and mail order you're looking at 12.5, $125, $250, and $625. So essentially, however the formularies filtered in this way will meet into these particular tiered off amounts. So to take a little bit of a look here at the network, so as I mentioned, the Choice Plus is UHC's largest national network, and this includes approximately in the region 120 hospitals. We're looking at close to 10,000 PCPs and then almost 12,000 specialists. However, on a national basis, if you're looking at that Choice Plus network across the entire United States, we're looking at 783,000 doctors and over 5,700 hospitals. So essentially, these numbers here are looking more regionally, and this is going to give you a way bigger picture down here in regards to what is nationally covered. So a very robust network and has a lot of different options for you and your dependents. So I do want to take some time as well during this presentation to walk through how you would find a provider, as this is pretty critical as you're going to be moving carriers to make sure that you understand exactly what you would need to do in the event that you're looking and searching for a new provider. So if you see here, reviewing this first slide, you would access the provider finder through United Healthcare's homepage. So you're going to go to www.uhc.com, and then if you notice right up here in the corner, you're going to click on Find a Doctor to go ahead and get started. So after that, you are then, you're going to be taken to a page that looks like this, and you're going to want to click on the Find a Physician, Hospital, or Health Facility, which is located under this General Directory section. So you'll see it's designated right here, and you'll click on this little link, and that will take you into the next spot. So here, under the provider finder, in order to go ahead and get started here on your basic healthcare needs, see who's in and who's out of network, in regards to PCPs and specialists, you're going to click on this first one. If you're looking for any kind of mental health care, you would click on the right-hand side. But for today's presentation, since the majority of the focus is going to be for, especially for the HMO, but looking at who's in and who's out of network for some of the things that you need, specialist or PCP wise, you're going to click on this first circle. The next option here is going to take you to this window where you can really narrow down the type of plan. So since we are going to be looking for a United Healthcare plan and not something from the state or Medicare, you're going to click on this first button here that says All United Healthcare Plans. The next step as you're looking for a provider is that you're going to be selecting the network in which you're looking for. So in this case, the Choice Plus network, as I mentioned on the former slides, is going to be the network that you're going to be looking for both of those options. And this is exactly how you'll see it when you go through the Provider Finder site. This is exactly what you're going to click on so that you can move forward with the process of finding your provider. So I went ahead and typed in the zip code of where I live in Chicago, downtown, but you can type in wherever you are looking to find care near. So if you're looking close to home, if you're looking close to work, you're going to go ahead and type in that particular zip code so that you can go ahead and get started on your search. At this point in time, then you can really break down your search pretty concisely. So if you're looking to just find people and look and see what doctors, if they have a particular medical group that maybe you and your family use, any specialists that you know their name and you want to search by, you can click this first option here. If you're maybe looking for a particular hospital or if there's a clinic, any kind of outpatient pavilion type, you're going to click on the second option here. If you're looking really pretty objectively at just trying to determine the types of services and treatments, so maybe you're not necessarily looking for a specific provider, but you're more so looking for what providers even offer specific services or treatments that you need, you would go ahead and click this third option here. If you have a particular condition or you have any kind of care that you're regularly looking to maintain and continue, and you're just wondering, again, similar to the service and treatments, what particular care is even offered for you through what condition your dependents may have, you can click here. And if you're looking to be able to estimate and figure out exactly how much something might cost with your new insurance, you can click here on the cost estimates button, and that's going to allow you to navigate a whole different part of the portal of calculating out expenses and really helping to kind of maximize that total cost for you as an employee. Okay, so to move into dental insurance now, as I mentioned, nothing is going to be changing here for your dental coverage. So your dental PPO through Delta Dental is remaining the same. So same thing in regards to reviewing on the PowerPoint. We're really looking and focusing on the in-network options for you through Delta Dental. Again, as it states here, and as you know, if you're on this plan, out-of-network benefits are an option here, but because we do encourage you to stay in network, we're going to only review those in-network options for you here. So the PPO and Premier are the two in-network that are tied within this plan. Both have a $50 individual deductible and then a $150 family deductible. Looking at coinsurance, so dependent on which PPO network this particular services fall into, the preventive, basic, major, care are all divvied up by percentages after you've met that deductible amount. So again, same thing as the pharmacy tiers and copays on the former slides for the medical. If you have a particular procedure or service that you're wondering cost-wise, please feel free to reach out and we're happy to help connect you in the right way to get the answers you need if for something specific to you. Orthodontia is not covered on this plan. If you see under the benefit maximum, your annual maximum, nothing's changing here. It's remaining at $1,500 for both of these in-network options. So I'm going to take some time to review some next steps here and some important things to note. Your enrollment choices will remain in effect for the entire plan year through next February 31st of 2019, as long as you're an active employee. So the only way after open enrollment that you can make any changes is through a qualifying life event. So some examples would be marriage, if you were to have a child, you went through a divorce, if you had an involuntary loss of coverage, so maybe your spouse was covered, but then they lost their job and now you don't have coverage, that would qualify you to come on to Painters USA's plan. This is not an exclusive list, but it does highlight some of the more popular ways in which qualifying events come up. The biggest part of this that's important for you is that if you have any kind of life-changing event, you only have 30 days from the date of that event to notify Human Resources. So that's critical. Please don't wait. If you have a child, please say something so that they know at Painters to make sure that you are updated in the systems. If you're married, divorced, the carriers will not grant exceptions beyond that 30-day window. So it's really critical that if anything comes up throughout the course of the year, that you do make that distinction to Human Resources. Enrollment forms must be turned in by Friday, February 9th. So you have about a week to make your new benefit elections and submit your form to Human Resources. If you have any questions as you're working through the process, please contact Eric. His information is located on the slide for your reference, his email, and then also phone number as well. Again, as I mentioned, if you have any questions or concerns, please feel free. If it's something that Eric isn't sure of, they can, at Painters, they can definitely get us in touch and we can work through any of your questions from this presentation and during your open enrollment. So thank you again so much for your time and have a great day.